Australia's health future is linked to its economic future, and at the core of that is spinal health.
I see a massive increase of back pain, especially in the last few years, and with that I see the impact that it's having on their whole entire health and well-being. So through their sleep, through their work, the loss of productivity, how they're engaging in activities and how they're enjoying and carrying on with life.
The tricky thing we find is how do we actually get psychology accessible in everyday practice? And so the key parts of the study was actually integrating these solutions for musculoskeletal clinicians like chiropractors so they can actually provide this sort of stuff to patients. It's not about chiropractors becoming psychologists or psychologists being chiropractors. It's about integrated care and interdisciplinary treatments.
Kim Lie Jom, clinician chiropractor in Chatswood in Sydney. I've been a chiropractor for 35 years. I own my own private practice. I currently serve on the ACA board as a ACA board director, a national board director, and also on the Eastern Regional Committee as well as the Audit and Risk Committee of the ACA.
Alex Malley, Chief Executive of the Australian Chiropractors Association. I've held the role for 4 years. The ACA is approaching its 90th year as a professional body, and our role is fundamentally to ensure that advocacy, professional education, CPD and other areas are met for our members, and to always act in the public interest. Our organisation has over 4,000 members and is growing at a really positive rate. Today we launched Spinal Health Month, which will address spinal issues at various levels of the age demographic. It's clear that all of our research indicates that spinal health is a major issue for many people in this country, and fundamentally that affects society more broadly at a health level. It affects it economically, and so our role is to ensure that we send that message out and we ensure that the research that we've commissioned is well read and well spread for our clinicians to understand what we're trying to achieve in our profession and how at different times we can work together if we need to cooperate in the event of assisting patients.
Spinal Health Month, or Spinal Health Week in previous years, is a really important initiative, not just for the consumer, but for the practitioners as well. It's a moment to stop and reflect. Are we educating people well enough? Are we looking into the research ourselves well enough? Stopping and reflecting on what are these important factors around it, like this year's theme for a healthy mind, is really important because it shows that we're staying on top of what's current and how we're educating our patients to deliver the best care.
The ACA are always in support of research for anything to do with spinal health and the general impact that spinal health has on well-being of all Australians. The latest research was Dr. David McNaughton's research regarding the link between and the association between chronic back pain and low back pain in Australians and how that impacted mental health. The overwhelming data that we have accumulated, as well as research prior to this, suggests that there's a strong link with chronic back pain and mental health issues.
My key research, particularly over the last 5 to 8 years, has really been around integrating psychological and physical therapies together, looking at how thoughts and feelings influence symptoms, and then how symptoms can influence your thoughts and feelings. Not only that, taking a clinical approach and working with interventions and evidence-based interventions is how well we can actually integrate them into practice. A lot of my research these days and the findings we have is there's a number of solutions for people that have good data behind what they do, but there's a clear issue in implementing them into practice. So a lot of my research now is getting these solutions and getting scalable adoption into practice. Our research worked with clinicians and patients to get an online pain management program from a national digital mental health service and look at integrating that into practice so it's real world, accessible and scalable across the country. We found that clinicians found it beneficial for their symptoms, for their patients, and we also found patients enjoyed the ability to not only have the physical components of their pain addressed by their chiropractor, but also the psychological and mental health concerns with professionals. The research began at least 2 or 3 years ago in the preparation ethics around the more kind of academic governance perspective of it. We were recruiting pretty much the tail end of 2024, mostly into the end of 2025. So a good year of recruiting not only clinicians, but also patients with ongoing pain. We had about 26 clinicians, both chiropractors, predominantly chiropractors, and physiotherapists who engage and treat people with chronic pain. And we recruited 60 people with chronic pain through the trial. Our dissemination effort really is around getting this information out to people. There's a big gap between research and actual clinical practice, and the research that we're trying to do is to try to kind of speed that up a little bit and bring evidence-based solutions into practice. So clinicians need to know what to do, how to do it properly, and what are the supports that are needed for them. And a lot of the research around this is developing those for clinicians.
Research validates what we see clinically on a regular basis. Without research, we can't sit at the table with all the other other professionals to be able to discuss important matters that influence health in our society. So I think research is a cornerstone for every profession. It allows you to validate what you do clinically, but at the same time, apply that back into the clinical realms to be able to use it for the best outcome for every patient that comes into the door.
Following on from what Kim's just mentioned, the ACA to date has spent $2.4 million on research and intend to be spending a lot more into the future.
I see people from all ranges of age and background. So I treat from as little as brand new babies all the way through to elderly care. And with that, each demographic or age range comes with different challenges and different comorbidities. The majority of the population that I see would be office workers, being a Sydney CBD practitioner. So a lot of that comes with high levels of stress and poor time. So they're not often seeking a lot of extra care simply from a time factor, but they have the health conditions where they do require that. Simple things like high stress load and then increasing blood pressure. So needing to have those sorts of things checked whether it's just with their GP or seeing somebody like a cardiologist. So I see a lot of different comorbidities present as well. Obviously things that I don't manage as a chiropractor, but I have a network of other health professionals who I refer out to. I think multidisciplinary care is a really important thing, and co-managing with other practitioners to get the best for patient outcomes, because no one condition really is isolated. All of our systems are having to work together and quite closely integrated. So if we're not looking at the big picture of that and working with other health professionals, then I think we're really doing a disservice to our patients.
It's very important for our promotion here to ensure that consumers at a wide level are appreciating the impact of spinal health on their overall wellness. Today we've looked at a 79-year-old woman who's had enormous assistance from chiropractic and the link to her mental health. We've got a 19-year-old girl that's been through her own physical ordeals and we've had to deal with at a chiropractic level. And so what we've tried to do is to give really simple examples for the wider community at each age area of how chiropractic can help with your overall health. I think what matters most is that we keep reminding people of the message. There's a lot of issues in society on cardiac health. There's a lot of issues with cancers. And the one thing I've learned from being a former academic and a long-term CEO is you have to keep coming back with simple messages. That's how people pick it up. We want more people to feel healthy. We want more people to go into the workforce and the workplace feeling comfortable and feeling strong individually from good spinal health care.
One of the things that a lot of healthcare is moving towards is interdisciplinary collaboration. One of the most important things that we can do as clinicians is to look at the opportunity whereby if a patient, and as you know, patients can be quite complex in their nature and what they do on a day-to-day basis. So it's really important that we recognise certain things that within our skill set that we can help with, and then at the same time be able to refer accordingly to other professionals that we can work collaboratively together in order to get the best outcome for the patient. I believe that over the years this is sort of where it's headed, and I think that more and more as we move towards into the future of healthcare, that would be a great standardised way to try and get the best outcome for every patient.
I think getting to the stage of my life, I look back and appreciate having had good health and being able to work and to be able to love my job and to have what we take for granted. I think what matters here is that as we address these issues of spinal health, as we address the issue of the positivity of being interdisciplinary and respecting each other's space and what skills we have to offer, the chances are that more people will go to work, more people will be productive. And if there's one debate going on in this country at the moment, and the centrality of it is productivity. How can you be productive if people are taking days off work because they're not attending to their spinal health? So I think we have this opportunity to, number one, make sure people understand how to improve their spinal health. Number two, how do we work together as a profession and across other professions to make sure that we all help each other, so that ultimately the third thing is more people are working, more people are happy in their life, and fundamentally the Australian economy is better off.